Warning, portions of this call have been altered to protect the privacy and identity of all involved. Ooh, HIPAA.
Get up your dead ass.
Welcome to the Medic Materials Podcast. If you came here for a healthy dose of EMS professionalism, you just made a huge mistake. Each week, we discuss all things EMS, review some calls. We also try to get you to pry open your wallets and buy some cool merch and join the Patreon. Somewhere along the way, we also do a fair amount of education and say some smart things. So push the kids out of the room, settle in, and let's get started.
Hello and welcome, everyone, back to the Medic Materials Podcast. Oh, Mr. Maha. Welcome.
Howdy.
How are you, sir?
I'm doing well. How are you?
You know, I can't complain today.
Just today. Yesterday was a different story.
Yesterday was a different story. Jess decided to go and buy some ducks. So, yep, we've been parenting 6 new baby ducks in our brooder, which means I needed a place for them to live once they were out of the brooder stage, which means I have been, meticulously crafting a new pen for them the last couple weeks. So that's been what I've been doing.
A new duck house.
A new duck house. Yes, a new duck house. So that's been fun. Yeah, you know, I can't really complain. It's been fun to be able to build some shit. I got some new tools out of it, so you know.
That's always fun.
That's exactly. There you go. Well, I guess I gotta change the intro. Miss newly christened flight nurse / RN.
We got a badass over here.
Who thought that was possible?
I mean, we all did. We all knew it was going to be just a when determining factor.
Yeah, well,
just a when.
this was bitty.
But never. Better late than never, I guess. Better late than never. But yeah, so congratulations on the new flight job. You're going to be now smarter than all of us all over again.
I doubt that.
I don't know. You were hamming up their education program, and I am married into the flight program. I know how dumb I am compared to them. Believe me.
It's wild until you experience it.
Yeah, it's funny to say with how much education.
I know.
I love education. I am petrified of their level of education.
It's wild.
Petrified.
It also just makes the way they deliver it. Man, if I had done this in my 20s.
Man, why didn't you? EMS was the way to go. Yeah, that was stupid. Yeah. Who the fuck thought that was a smart idea?
Yeah, I don't know. I don't know.
It's just more fun being a dumb paramedic sometimes.
Dude, seriously, it's a lot of fun being a dumb paramedic. And it's probably even more fun being a dumb simple paramedic, but
You got the dumb simple EMTs.
They're great for demos. That's all right. I was doing a class the other day, and I was showing a video of firemen giving Narcan. Or police giving Narcan and firemen coming up and saving the day because we all know they're the real heroes.
That's right.
And in both situations, both videos that I showed, the cops do like somewhat care, and then the firemen arrive on scene and bring their tablet. Nothing else, just their tablet. And the person's still like unresponsive, unconscious, gagging on like their own tongue, and they're just like, I'm here to save the day for the demos. It's like, fuck off.
Go get my chart started.
Yep, gotta get my chart started.
As long as
Gotta
you get a
love it.
signature, you're all set.
Yep, that's right. So we got a really awesome call review today. I think the audience will be intrigued through this one. And it's a subject matter that I've been seeing a lot of in my own practice over the last couple weeks, and in our local area. I've seen a couple of these kind of calls go out. This one was actually sent in to us by a listener, so I just want to shout out thank you to that person who sent in this call. They already know who they are because I'm sure they will be listening to this show. They've been waiting patiently for this episode to come out. But before we get to the actual breakdown of the episode, let me just give you guys the rig check for today. So, of course, we have to plug the Medic Materials sticker merch. Go to medic-materials.com. You can see all the stickers there, including the Diesel Bolus and the Black Cloud EMS and the BSI Scene Safe, and my favorite still to this day, I donated to the Phil Foundation, as well as the I think the most popular one that we have is the Medic Materials podcast Thin White Line EMS Star one that just goes like crazy. But medic-materials.com, you can find all of the sticker merch there. All of that goes directly to support the channel as well as the show. Next, if you are an EMT student or might be thinking about becoming an EMT student, Medic Materials just launched a brand new tutoring service for EMT students, current and future. There is more information, medic-materials.com, for the tutor services. There's packages of a single tutor session, which is 1 hour, one-on-one with me, 3 sessions and 5 sessions. And we will literally break down where you're struggling, what you're struggling with, and try and get you over that hump to be able to actually pass EMT class and nail that certification exam. And then lastly, we need to shout out our probably coolest duo of the shout outs this time, which is the country of Georgia and the state of Georgia. So thank you very much for listening in both those locations. It is the first notification that I've gotten that we have been listened to in the country of Georgia. So hopefully that grows. So thank you very much for listening overseas to everybody. We have a lot of listeners that listen in like the UK and Ireland and Canada that are faithful listeners, like legit faithful listeners. So if you've been here a while, again, thank you very much for your support. So ladies and germs, are you ready?
Do it.
Do it.
All right. So your system today is a rural volunteer ambulance district. This agency is ALS certified, but only when an ALS provider shows up for the call. So in today's particular call, the ambulance will start, that's a key word, start as an intermediate level service with 1 AEMT and 1 driver who is CPR certified. There are 3 hospitals within this distinct area. The first is a rapid intervention clinic. It's a 4-bed ER with a PA. They have no specialties and is 7 minutes away from the scene. The second hospital is a community-based hospital, basic level care, no specialties. That is 45 minutes away. And the third is a medical center that offers PCI and level 3 trauma level services. And they are 30 minutes away from this scene.
Where's the
So-
closest funeral home?
So you got
5 minutes. 5 minutes.
You got like bupkis for great options here off the start. So we're already completely fucked, like already. So in the dispatch, you guys are dispatched a Bravo priority or priority 3 to a local Airbnb cottage for a 26-year-old male who's reported to be lethargic with altered mental status. So for a young person with these sort of complaints of lethargy and altered mental status, where does your brain go right off the rip? I know where mine goes. What was that?
Alcohol and drugs.
Alcohol and drugs.
Yeah,
So
absolutely.
I'm going to have to agree immediately. I think, are they intoxicated or are they high as a fucking kite? Or are they overdosing or whatever? Other than that, do you guys have like a secondary? Oh, this isn't alcohol and drugs.
Trauma.
Is there a secondary? Okay,
Trauma.
so trauma. I like the trauma idea too.
Because
you know?
they're young and stupid, you know.
And freaking, we all know that men do really stupid shit when they're young.
We do stupid shit when we're old too. It just
I
hurts
mean,
more.
That's fair. I feel like the prevalence of stupid shit is really big when you're young. And then we still do stupid shit when we're old. It's just less frequent.
It just takes longer to heal from that stupid shit.
Right. Exactly. So I would have to
We,
agree
we,
with you
we learn the
guys.
value of healthcare and the cost of insurance, so we do less stupid shit.
That's right. Absolutely. So as we get to this scene, the crew arrives and is met by a county sheriff who tells them that when the sheriff they arrived on the scene, they entered the cottage and was shown to the bedroom by the girlfriend and saw the male lying on his side, not alert. The deputy said they attempted to wake him up, but couldn't. So what did they do, guys?
Narcan, absolutely.
They absolutely did exactly that. They put in the Narcan right up the nose, administered 8 milligrams of Narcan.
That's it. Must
That
be
is
all
it.
they carried, huh?
So from what I've gathered, they have 1 Narcan, dosage, and it's 8 milligrams in 1 dose. So this is 1 shot up the nose. That's all they carry. 8 milligrams. The deputy said that while they were shooting it into the nose, he was actively trying to push it away from his nose. The deputy then came out of the house because he heard the ambulance backup alarm. So I just want to ask, what is your predictions on what this crew is likely to see when they re-enter the home after this cop had given the Narcan and all this stuff?
Probably still lethargic, but now he's going, you know.
Like it's just pouring from his nose as he's like, blah, blah. Yeah. I didn't hear any of that, Em. I'm sorry.
Or he's coughing because they didn't aerosolize it, and now he's just aspirated everything.
So I wonder, I haven't gotten my hands on one of the large dose atomizers, those like auto sprayers.
They're hard to push.
They're hard to push, but like some of these are 8, 16, 12 milligrams. Like I wonder if because the dose, like the dose of the saline doesn't change. It's just a higher concentration inside the saline. I wonder how that affects absorption in the nose. Like if it's harder to absorb because there's so much of it, you know? I don't know. I'd like to see the science on that.
Similar.
It should be similar, but yet they still give like 37 of these things.
I know.
So
They're not overdosing. Now we're just drowning in all that pulmonary edema he just created. But hey, don't worry about it.
Exactly. We don't need to worry about it. He's 26. He doesn't have fucking heart problems and pulmonary edema. It's fine. So the EMT grabs their BLS first in bag and enters the home with the deputy. Once inside, they see the male sitting at the kitchen table, making a bowl of cereal. He appears extremely tired. Eyes are half shut. Speech is extremely slow and garbled. The intermediate approaches him and asks him what the heck is going on. He tells him that he's here celebrating his birthday with his girlfriend. They've been hanging out all day. Nothing's wrong. He's fine. The AEMT proceeds to start their initial assessment. They find that he's lethargic and confused, does not recall the time other than his birthday. Airway appears patent. No fluid or debris is seen within his mouth. Breathing appears shallow but regular. Radial pulses are present but slow and also regular. GCS of 3, 4, 6 for a grand total of 13. So pause here. Anything with this stick out to you guys so far? Or is it just kind of like, okay, he's not terribly terrible, but there's some weird things going on. I'm going to go the newly christened flight nurse first.
Yeah, I mean, I definitely want more information.
Do you like it? Not like it?
I don't like it.
Okay.
I don't like it at all.
Maha, what about you?
Barring, drugs and alcohol, if that's not immediately available information, no visible trauma. The next thing you have to go with is neuro. I mean,
So like neuro, infection, endocrine, like there's so many options.
Yeah.
Mhm.
There's so much that it could be. It's like throwing a dart at a dartboard at this point.
Right.
Right.
Yeah.
There's
Yeah,
so many
now when I
possibilities.
I dive into the questions.
Yes. I think
with the
that's
girlfriend.
where you need to go. Like, what is the backstory of this to kind of get you into a direction of where you can lead yourself? The other thing that I thought was kind of interesting, just on the other side of things, we always, kind of criticize what the providers bring into the house with them. And this is an intermediate who just brings his BLS bag.
Yeah, I think that was a poor choice, but
intermediates have ALS bags. They have, things to be able to do ALS-y things, as Butch would say. And they just kind of left it in the truck. Like, oh, I'm just a BLS provider at this point.
well, I feel like a lot of people do that because in their mind they're already deciding like, oh, it's a young person, like it's bullshit.
That's probably a good thought process as well, too, because, how many peds do we go on and they're like, yep, they're fine until they're, oh my God, they're not.
About that.
About that. Tune into the next
and how did they get dispatched too? Did it get dispatched as Alpha or Bravo? You know what I mean?
Is
And
it
then like
Bravo?
This
Bravo
was
person lethargic, altered mental status.
Yeah, this was a Bravo, lethargic and altered. So
How old
like,
is this person?
how old? 26.
26.
Yeah, 26 male.
So they're coming into the altered Bravo. They're thinking, yeah, it's nothing. And here you come in with your BLS bag, like doop de doop,
Right. So, as this patient continues to try and eat his cereal, the intermediate moves into the next room to talk with the girlfriend. She tells him that they arrived yesterday for a birthday weekend. He was somewhat somber yesterday, but mostly normal. Today he slept in, and then they both began, drinking because it's their birthday. She admits that they finished a few bottles of wine, a 12-pack of beer in celebration today, and that he's steadily been getting more and more lethargic through the day. He went to lay down and she couldn't wake him. This is when she requested EMS because she got scared. The AEMT actually does some fairly good due diligence, and asks if they had done any illegal drugs. And she says, nope, I don't do drugs. He used to do cocaine, went to rehab for it, but you know, as far as she knows, he hasn't touched anything since he came back from rehab. So with that information, the intermediate begins to move back into the kitchen to find that he has now become completely unconscious again, and his head appears to be inside his newly christened cereal bowl.
What a bummer.
What a bummer, right? So, yay. That's
So he's trying to get the milk, but you know.
He's just drinking it. Relax.
Oatmeal mouth like give you this milk.
Abso-freaking-lutely. He's going to fix himself. He just
Yes,
needs the milk.
self-help.
Self-help, exactly. So they rush over to him. They lift up his head to find his face is wet with milk, and there's a bunch of Fruit Loops stuck to different parts of his face. If you guys saw that, like, are you going to giggle? Because I'm going to fucking giggle. Like, I don't care. I'm going to giggle.
I'm going to be laughing on the inside.
No, I'm going to be laughing on the outside.
I'm probably going to be laughing on the outside, too.
I'll be moving, but I'll be laughing.
Right. They tilt this kid's head back. They open up his mouth. They attempt to wake him via a deep sternal rub. He groans. He opens his eyes briefly. The AEMT then tells his driver partner to grab the stair chair. They need to begin extrication.
The stair chair?
The stair chair. Yep.
Yeah, no. How about
So,
no?
so this provider wants to get this guy out of this cottage, like get him outside, rush him, because I think they're like, oh my God, this is bad. Where are you guys with good, bad, ugly so far? What do they need to do? Because you're already saying, oh, stair chairs maybe not appropriate. Where do you guys go from this?
I mean, we just went from bad to ugly. So, you know, I think on the initial, if he's standing up, making his cereal, talking to us, like, his ABCs are good. You know, he's shallow respirations, he's bradycardic. I get that. But now he's unresponsive. You need to go back to step one and start fixing these things.
Right.
Because, like, is he breathing?
Well, and that's it too. So, like, yeah, you know, he's found face down in liquid.
Right.
I mean, did he aspirate
Yeah,
any of that?
aspiration,
Is he blowing
He's got
bubbles
Fruit
in this?
Loops
Is
on
he
the
breathing?
face. How many are in the airway? You know what I mean?
Exactly.
Well, right. And, like, he no longer can secure his own airway. Like, he's not protecting his airway. So now we
Right.
need to get back to A and start again.
Right. And do you guys, so how are you guys extricating him from this scene?
That's gonna be a Reeves.
I think so too, but I'm also like, there's things I got to do now.
Agreed.
I have to put him in a stair chair when he's unresponsive. I have no idea if he's breathing. I know he can't protect his airway, to get him out, to put him on the stretcher, to put him in the ambulance. I need stuff done now.
Yep. So what is your go-to airway?
Try it OPA,
I
see if
guess-
he takes it.
Okay, so he's unconscious. Maybe he's fully unresponsive. GCS to 3. Go with the OPA. Are we at least gonna? I mean, we don't have a suction unit, so we can't even suction this guy because we didn't bring that in. So like, we're limited to oxygen, BVM, and airways.
Some kind
BLS
of airway.
airways. You know, maybe this is the time for OPA, NPA. You know, try the OPA, see if he gags, switch to the NPA. So while the
I
driver,
mean, you got some suction right here. We just go, and, you know.
I mean, you could do that. How many people, you know, dig things out of airways anymore? You know, it's
I like my fingers.
I mean, Butch only has half of them, so he could afford to lose a few more.
No.
So while the driver goes outside to grab this stair chair, the intermediate or AEMT, whatever you want to call him,
The
decides
half medic.
that the half medic, the ALS light medic, as Foster used to tell me I was, decides, fuck doing all of the important Emily, now flight nurse, airway things. Let's do blood pressure and vital signs because that's way more important.
Did he get a signature yet from the girlfriend? to treat.
Nope.
I
We
mean,
get the
and Billy.
demo.
Nope. Did he get the demos? Damn it. But he does absolutely get vital signs. And they come back as a blood pressure via a manual cuff as 120/66.
Bullshit.
A heart rate of 78 via the pulse ox probe.
Nope.
Respiratory rate of 12 and unlabored, but shallow. An SpO2 of 89% on the room air.
That's
I'll
probably
just-
the only one. That's probably the only one I believe right now.
Okay, so why are you guys poo-pooing this?
Well, didn't they? I don't know. I mean, if I felt a slow rate and then the pulse ox is telling me it's 78, I'm gonna believe myself first.
And if he's got a slow rate and you got a blood pressure that's almost normal, yeah, no.
I mean, I don't know. He's 26. He could probably tolerate that for a while.
So I do tend to agree with you guys in the fact of like 78 is not slow, but yet they felt they felt slow. So who's wrong here?
I mean, and at this point, you kind of just have to go with the vitals, but there's still something there that you should be fixing now.
Mhm.
Agreed.
We haven't fixed
Vital
airway,
signs
we
is
haven't
not.
fixed breathing. We
Yeah,
haven't
because
done it
Because if you don't fix it, you're not going to have any of the other cool stuff very long.
exactly.
Yeah.
Exactly.
I 100% agree. I don't think that vital signs was the answer here. I think he needed to go right back to airway, breathing, circulation. Is this guy even fucking breathing while he's doing all this?
12 and shallow,
12 and shallow, right?
but not well. He's at 89%.
So as he's breathing in all that milk, you know, I mean,
He's trying to get it by osmosis, you know.
the man needs his milk.
Also-
So once the driver's back inside, they place their hands under his arms to lift him into the stair chair. And all of a sudden he opens his eyes.
Open your mouth like give you this milk.
Wow, that was really delayed. I hit that like 40 seconds ago. So driver comes back in the house. They place their arms underneath his arms to lift him up and into the stair chair. At this point in time, he opens up his eyes and he kind of shrugs them off and says, like, "What the fuck are you doing?" in a slurred and garbly speech. He becomes a little bit more alert, telling him he's fine. He doesn't need to go. And it's at this time that his girlfriend is like, "Fucking shut up. You're going. You scared me half to death. Fucking you're going to the hospital." And then she starts attacking him with, "What did you take?" Which then gets him saying, "Go fucking fuck yourself," because they're both pissed drunk. And, you know, she's accusing him of, you know, being high as fuck. And he's like, "Go fucking fuck yourself. I'm just drunk." So the intermediate insists that this dude has to go to the hospital, as clearly he does not have the mental capabilities of staying at home, right? And now it's a volatile situation, so who the fuck knows what's going to happen. So, you know, the deputy sees all this, kind of gets involved, and it was like, "Dude, you're going, I'm going to write some paperwork, and you are going to the hospital because we cannot leave you here." So the guy under police custody, non-handcuffed, realizes what the situation is, stands up on his own, but staggers all the way towards the front door, leaning on the wall for the ability to actually stand. Like, literally on the wall, dragging himself on the wall. Staggers outside, flops onto the stretcher. Crew gets him into the ambulance. They secure him, you know, they secure the stretcher. And at this time, another member of this agency arrives. And as I alluded to earlier, it is a volunteer paramedic member. They get in the back of the ambulance and ask the AEMT, the intermediate, if they need anything. "Do you need any help?" So I'm gonna pause there. I know that I'm gonna get into another discussion here in a few seconds, but your whole facial expression changed that whole last couple paragraphs. Where are you in your headspace at this point?
I'm just processing. I'm trying to think what's wrong with this guy. I don't know.
Okay, because we're kind of all over the fucking place.
We haven't, well, and it's hard too because like they're just bouncing all around. Like they're just, oh, I gotta get vitals for transport. Let's get those. Oh, we gotta get him out. Like they're not looking at the patient, assessing him.
Right. There's no real flow of anything here.
Yeah, so it's kind of hard. Like, what's his blood sugar? Is he having seizures? Is that why he's going unresponsive? Did he take something? Like, I don't think it's cocaine, so we're good on that. But like, is this truly just alcohol?
But also,
you fix that SpO2 of 89% and see if he mentates better. Anything?
Maybe if they did any of their, primary assessment stuff.
Come on, hypoxia never causes these problems ever.
No.
I also know that you're going to tell me that they brought him to the 4-bed ER, and that's going to piss me off even more.
Stabilization.
That's right, stabilization. You never know. I might shock the world and give you a blood sugar in this one. You never know.
For this volunteer medic to give me a blood sugar and take him to a big hospital. I'm holding out.
You never know. Butch, do you have anything to add with this whole thing? If you guys aren't watching this on on video, the looks these two are giving is fucking hysterical tonight.
Yeah, like nobody's controlling the scene whatsoever. They're just letting everything go haywire. It's like I'm surprised they don't have Martin Harding and Mazzotti on speed dial right now because
well, can you imagine?
This is fucking terrible.
Him get off the stair chair, stagger, so he can't even walk right. To the stretcher. What if he just felt face planted in any part of that?
Yeah, he's out on the deck or whatever and falls off the stairs, and now he's really.
Why would you let them do that?
Yeah, just.
It definitely, like, I almost feel like there's so much trust given to this guy that, like, we trusted the lethargic, altered guy who
was literally just passed out, drowning in milk,
right,
to walk outside to the stretcher.
But before that, Butch, they let him alone in a room after being altered, right? Now he's awake. What do you think? Like, all of a sudden he's fine? Like, way too trusting here for me.
I agree.
Like, nobody's got eyes on this guy.
And right now he's literally, he's going to have paperwork signed. He's in police custody. Like, you just don't let a dude get up and walk away. Like, he's pissed off. He's not going to get outside and run away. Not that he's going to run very far, but hello.
Right. It's 100% fact. So remember, volunteer paramedic has now gotten into the ambulance, right? The intermediate gives them a brief report because they don't have much of anything. And
he likes Fruit Loops.
He loves Fruit Loops. I didn't even get a message to say that they wiped the Fruit Loops off the guy's face. So just imagine right now that the guy still has Fruit Loops all over his fucking face, because that makes the story even better.
Picking them off and eating them.
I wonder if this is like a guy who thinks they all taste the same or different. I wonder.
That's the real information I need.
Right? Fuck
it's
the blood
sugar. It's not even the real Fruit Loops. It's like the store brand Walmart style, that
the Dollar General one.
The fruity O's or whatever the fuck they're called.
It's the the 30-pound bag that gets stale in a day.
So this intermediate gives a brief report, and they say that the medic, they tell the medic that the cop gave aid of Narcan, and quote, that seemed to work.
Oh, for fuck's sake.
He was briefly unresponsive, but otherwise very lethargic and confused, but vitals were good. The medic decides, this sounds weird. I'm going to choose to ride to the hospital with this intermediate person, as this guy now, while on the stretcher, has closed his eyes again and is become responsive to only very loud verbal commands.
So he's starting to die again?
He's going downhill again. So I think we're all in agreement that this medic is doing the right thing and going with this intermediate. I think there's a kudos, you know, in the medic's future. But are you concerned with the mental status roller coaster that this guy's on and where this is leading? Like, where do you think this is going?
I think it's still kind of hard to tell right now because you don't have a good assessment done. You haven't asked a ton of questions to find the right thing, other than, you know, the girlfriend now thinks he's high on something. That's about the only thing.
And now we've lost the ability to use the girlfriend because we're gone. So we don't have anything. We're on what this guy can tell us. And as of right now, he's unresponsive.
And if you take this for face value, like, we've already fucked up, we can't change now, we're in the ambulance. This man is going unresponsive for a significant amount of time. This isn't like a 3-second unresponsive, which is still a big deal to me. For a significant amount of time. And we have done zip about it.
Yeah, bupkis. Nothing. We've taken one set of vital signs. Good for us.
And we've asked maybe 5 or 6 questions to the girlfriend, and nothing. It's like,
and that's it. You know,
we haven't investigated this at all.
Nope.
No. And
we have no past medical history. We have nothing. We have nothing on this guy, as far as we know.
We have that he was in rehab for apparent cocaine use, and that's
not helpful.
We don't have. Is he on meds? Is he on any allergies? Like, is he on any allergies? Does he have any allergies? Like, is there medical history? We know bupkis.
You know, did you guys, you know, when you were drunk last night, did he fall down, smash his head, you know, on a wall somewhere that we don't, you know what I mean? Like something like that, you know?
Yeah.
How far did they travel? Is he like high risk for PE right now? Is he?
Yeah.
There's so many questions I have.
And the sad part is that the world will never know, because we don't get the answers to these questions because the crew left the scene too fucking early. So, you know, there's one thing to really behold about, you know, oh, this is over our heads. We need to get them to a hospital. But you need to do everything that you need to do on scene. Like, you can't just leave the scene and then be like, oh, shit, I needed meds. And well, they were at the scene. Fuck. Like, we need to ask those questions before we leave. It's okay to take time to get the answers you need before you leave.
Well, I feel like also this crew, and like, I don't know where they're from, but they went into this thinking like the same as we all did, drugs or alcohol. And then they said, oh, this guy's just drunk, let's go. Like, it's the regular drunk that we have in our city that every single city has, so I don't want to hear it. It's, you know, our frequent flyer that's always drunk. Like, come on, let's go.
But even at this, even at the same point, you know, nice plug for our frequent flyer travel services sticker, medic-materials.com. But even with that thought process, this AEMT literally says to the medic, cop gave 8 of Narcan, seems to work. So are they thinking that, oh, this is an opiate overdose because, oh, the cop gave Narcan and now this guy was up and walking? So, like, I don't even know if they're on the alcohol train. They're to me
whatever substance you choose, they're in their mind. They're like, oh, he's a, you know, whatever substance, pick one.
Right.
I think they're way off the ball with this. Even if it turns out to be alcohol in the end, they're like, oh, Narcan worked, we're fine. Like, never mind the fact that he's still going unresponsive.
Yeah, I mean, you tell me if I'm, you know, little, you know, if I were to be drunk and laying on my bed and somebody shoved the thing up my nose, I'm probably gonna be up wandering around too. Probably, you know what I mean?
Probably.
That's not a comfortable experience.
But if I then go unresponsive again, if I vomit, am I going to get that out of my airway? Probably not.
Nope.
No. but you don't need an airway. It's fine. Okay, so let's see. Where did we leave off?
I can cross it off the A part, right? Don't need an airway. Okay.
Don't need an airway. Nah, that's just details. So the crew begins transport. Which hospital, Em?
The 4-bed PA staffed hospital.
Which bed, Butch?
Oh, they're gonna go in the hall because it's overcrowded there anyway. So they're just gonna go in the hallway.
They're gonna go in the hall.
Yeah.
Nice. So I got to give the second kudos to this paramedic. The crew does indeed go to the medical center 30 minutes away.
Good for him.
So the
Straight
medic
to triage.
Straight to triage, right?
You
So
want triage, okay?
the medic decides what's more important than airway, breathing, circulation, and an assessment.
Bless his soul for her.
But to connect the cardiac monitor, because that's where we got to start. Initial rhythm shows sinus in the low 60s. NIB cuff is also connected and run. Returns is 113 over 53. SpO2 on room air still, because they've done no oxygenation or airway control, is 91%. Medic places them on end tidal, which initially reads 47. And the AEMT is gifted the opportunity to do some ALS light things, and they search for a line, a suitable IV site. Because again, we still haven't done any airway, breathing, circulation, or assessment. We're just doing things. Busy work. Bullshit. The intermediate finds a suitable site and successfully places an 18 gauge in the right arm. Good for them. Woohoo. A few minutes goes by and the monitor begins to alarm. Any guesses on what the alarm would be?
Heart rate. Or, I'm sorry, respiratory rate.
Going with the apnea alarm?
SpO2.
Okay, I like SpO2, apnea alarm. So it is indeed the apnea alarm from the end tidal capnography. And they call to him, say, hey, yo, dude, wake the fuck up. No answer. They sonar rub him, and he takes in a shallow breath and then magically, rhythmically starts breathing again. At this point, his eyes open briefly and then close once again.
I think we should RSI this guy. What the hell? Oh, wait. We can't. There's only one medic.
Foreshadowing. Well, let's just hold on that thought there, Maha Butch. So, another few minutes goes by, and magically, another fucking alarm goes off for an apnea alert. And they, again, try and shout to him while also performing a deep sternal rub. This time, there is no response to either.
How is the stretcher positioned at this moment? Is he laying supine, which I'm imagining, or is he actually...
He is not,
Followers, or...
he's not all the way up. He's in like a 20 to 40 degrees, somewhere in that area.
I can only imagine laying supine going, he's okay, just leave him like that.
Oh, I could totally see that too.
Don't worry.
They quickly check his heart rate. It's maintaining in the high 50s. It is gone away from the 60s. It is now in the high 50s.
That's not maintaining. That's declining. But hey,
well, you know, it's whatever.
That's the opposite of maintaining.
Words don't matter in America anymore, people.
4 beats. Relax. You could have gone 62 to 58. Relax.
Oxygen sat has dropped to 85.
We still haven't done anything for that.
Nope.
He's got the end title on. We're fine.
Yeah, he's fine.
I mean, it's a lot. It's a lot of work to plug that other port into something.
I
When
mean,
there's 2 people back there right now.
They're busy getting demos. Okay.
I don't even know what the fuck they're doing. Like, clearly it's just fucking scary. That's what it is. It's fucking scary. Like, as we'll see. Let's move on.
They fill out their
So-
application. They fill out their applications for the fire department.
Absolutely right. Chest is felt after the decline in saturation to 85. Chest is
fuck are
felt
they-
by the
What are they feeling
intermediate
for?
because he just went apneic twice, gasped like, oh man, started breathing again. So I guess they're checking breathing finally. I mean, woo. The intermediate chest checks the chest, and they report that it feels like it's only barely moving, quote, if at all.
Maybe
So-
you could bag. Do something in bag.
So where would you guys like to go from here? If this is you coming into this as the rescuer upon rescuers, how do you fix this situation?
First, get my lawyer on the phone, and then then we'll go from there. But
Yeah, Johnny, I'm gonna need a little help out here. I mean, clearly they have foregone all of the important things and focused on all the trivial things that don't matter.
well,
mean,
like you
they
say,
still need
it's
to
busy
go
work.
A, B, C, and start with A. They haven't done that yet. So that's exactly where I would start.
Bingo. This guy's more or less unresponsive. I
With-
bet he'd take an airway now.
And very
Like-
little breathing effort. So
You got to breathe for him. Oxygen, because his sat is in the, mid 80s.
Those
his-
cool little eye gels that you guys have now. Just there you go.
Yeah.
oh no.
His
Cardiac arrest for us BS providers, man.
his heart rate's dropping. His blood pressure's dropping. Like, everything seems to be going on the downhill slope of the whole shock experience. Like, it's reached its peak and now it's falling. So the medic tells the AEMT, you got to start ventilating him. BVM, oxygen, go. Meanwhile, the blood pressure cuff auto inflates, and it's recorded as 97/47 at this point.
Sure.
So it drops another 10 points. It was at this time that we have to bring up what the Maha brought up. And the medic goes, I think we need to have a discussion on whether to take this guy's airway and intubate this guy, because clearly his respiratory drive has crashed. And the intermediate tells the medic that they believe that they are absolutely now forced to intubate this guy. Now, let me just actually, let me pause because I'm getting to that. The medic gathers their intubation equipment, including a video laryngoscope, an 8.0 tube, a commercial tube holder. Medic lowers the head on the stretcher to flat,
Ugh.
pushes a pillow under his shoulder blades. He then tilts his head back as the AEMT bags a few more bag breaths in. At this point, the oxygen sat is 89. One attempt is made to pass the video scope blade into the airway, but this guy immediately gags on the blade. Medic removes the blade, and the attempt is discontinued. So, before you guys give me anything, I'm going to ask you guys whether you would go ahead in our system, if you had a second medic, would you RSI this patient? But I also want you to think in terms of this system. This system, if you guys are put into these providers' shoes, does not need 2 paramedics. It is a system that I have never heard of before, but does exist here. And that is a 1 paramedic RSI with a, quote, RSI assistant. It is apparently a specialized course that BLS and intermediate providers can take, that if you are certified as a RSI assistant, you can assist the paramedic in the RSI, and the paramedic can do the drugs while the intermediate or EMT is doing all of the other helpful stuff. And then once the drugs are in, the paramedic can intubate. It's a very weird system. I've never heard of this before, but it is a thing. I looked it up just to make sure this is actually a thing. It's a certified course through this state's curriculum. And this is how they provide RSI without 2 paramedics. So this particular intermediate is a certified RSI assistant. So the option of a RSI is actually on the table for these providers. So give me both of your perspectives. If you're in our system where you need 2 providers and you say you have them in the what if, would you? And if you're in these guys' situation where you have paramedic and intermediate who can do it, is this the proper place for it? What are your thoughts there, Maha? You're deep in thought.
I think right now we need to bag this guy up a little bit, try to get this pressure up a little bit, because if you try to take this airway right now, by either way, this guy's gonna die. Yes, he does need an airway of some sort, but our pressure is too low right now. The map is like what, 61, 62, something like that right now.
It's under 65, yeah.
And even we're what, 91? You said SPO2? Yeah, we got to get this guy bagged up a little bit, get some pressure in him.
89 at this point.
Yeah.
Yeah, he came from 85 to 89. So
and
that's before the attempt is made. So it's probably back to 85 now that they actually put a blade in this guy's mouth, without any type of passive oxygenation. No, nasal airway with oxygen in it, or, nasal cannula with high flow. Nothing like that was done. So,
yeah, you need to bring him up a little bit before you try this, or else he's just not gonna make it. Even if you try it and you're successful passing the tube, it's not gonna work.
Already. No, I'm with Butch on that. Like, I think you need to think RSI and start going down that route, but you need to do some serious resuscitation before you try this.
And at this point, the heart rate seems to be falling. The SpO2 seems to be falling. The blood pressure seems to be falling. They haven't fixed any of it, right? They haven't done fluids for the blood blood pressure. For the blood pressure, they haven't done anything for heart rate. Resuscitate. Maybe that heart rate comes back up. What really have they done other than BVM this guy for the last 2 minutes? That's it. That's not really a good resuscitation. I think you guys are right on the ball in that you have to, before RSI is resuscitation.
Mm-hmm.
Like you have to get this guy's saturations up. You have to get their pressure up. You have to get their heart rate up so that they can compensate for the drugs that you're about to give them, which automatically lower all of that. So yeah, I don't think it's the right time, especially, I mean, no offense to this system, but I don't know how keen I would be with a ALS assistant.
Yeah,
That's weird and wonky.
Interesting.
Not saying that we're a better system, but I don't think I would be very okay with that kind of thing.
had 2 medics in your entire region, and then you had a bunch of AEMTs that took this very specific class on RSI, how is that any different than your class on RSI? I don't hate the idea of this. I don't hate it.
I just, if they were allowed to give meds, or if they were allowed to, like, the intermediate being allowed to intubate the patient while the paramedic gives the meds, I'd be more on board with it.
So in our state, they could intubate up until what, 5 months ago? So like, okay, the intubation
Not for an RSI, no.
No, not for an RSI. But like, you're giving the meds. So I would, as if I was a paramedic, I'm drawing up the meds, I'm giving them. I have plenty of time for those to kick in, to go to the head. My airway's already set up, and now I'm going to drop the tube. I don't hate the idea of this. And it
I mean,
forces you
your intermediate can draw your meds up for you. I mean, they can draw meds up.
They
But
can
don't
draw
even
meds
have
up.
to. They don't even have to, though. Because by the time, I mean, like, once I'm all set up, they're pre-oxygenating.
But
It forces you to slow down.
So that would be my concern, is we all know how terrible paramedics are at RSIing, just in general, especially like in our system. And now we're saying, okay, you have to do all of this by yourself. So like, there's no other provider for you. I'm diminishing intermediates, but there's no other ALS, paramedic level provider that understands all of this stuff for you to bounce ideas off of and actually be able to sit there and have a conversation. Oh, this happens, whatever. Like, if they were able to give certain meds like sedation or pain control or pressors, I think I'd be okay in the post aspect of it. Because, like, if I'm trying to keep them sedated, keep them ventilated, and fix all of the other stuff, that's too much for one person.
But you're not, though. You're just bouncing. So, like, I'm drawing up the meds. I'm giving the meds. I tell correct me if I'm wrong, a BLS provider can take the RSI assist class, correct? Is that what you said?
Yep.
So, like, as a BLS provider, I have the RSI assist, so I know the process of what's going on, right? So the paramedic draws it up, they give it, you're forced to pause. The paramedic then says, like, okay, I want to know what these stats are at every second. Like, just keep reading them out. Tell me, just keep reading the vitals. You drop the tube. The EMT can then ventilate, because that's 100% something I can do. And you can go back to post sedation and monitoring.
Yes, you could do that.
Listen, I'm grateful that I work in an area that it's not like that, but if that's the only option you have, I don't hate that it's an option for them to be able to do RSIs.
So I take it back. BLS providers are not allowed to be RSI assistants. I'm looking at the actual documentation now. It is AEMT or non-RSI credentialed paramagician.
Okay. So now you have a higher level person as your RSI assist.
Yeah.
I don't hate the idea. If that's the option you have, you made it work.
Yeah, let's see. The curriculum is sim equipment, airway assessment, lab, bougie, endotracheal tube, difficult intubations, observe an RSI in action, RSI pharmacology, another lab full of pharmacology, rescue airways, more airway sim, putting it all together, and malignant hyperthermia, more sim lab, documentation, QI, and then the exam. It's a full 8 to 5 course.
I don't hate the idea.
I mean, it's definitely interesting. It's different.
Just think about it. When if you and I are doing the intubation and doing the RSI, you have one of us doing drugs, the other one's getting the tube. What else is there for, somebody to do? Honestly, that's
I mean,
Yeah,
I
other than talk about the case, like, oh, are we gonna do this? We could take,
Well, but I get where that comes in, like, okay, I want somebody that knows what they're talking about to bounce this off of. Like, we want to run through this case so that there's two people in agreement. That I can appreciate. But like, if they have 8 to 10 weeks of training as an advanced provider, and then they take this special class, like, why wouldn't that be your person to bounce this off of?
I mean, it's totally appropriate in the fact that intermediates, you know, at least in New York, the intermediate class is about 10 months long, you know, so it's a fairly long class. It's just under a year. It's asinine how long it is, because it's like, or no, I'm sorry, it's like 8 months. But still, it's close to a fucking year, and you take a paramedic, you know, course in a year. It's like, just fucking go and get your paramedic. Like, it's stupid. It's 4 fucking months. You know, but I remember being an intermediate, and they don't teach you a lot of stuff. They teach you, here's how to do monkey skills. Not here's why you're doing the monkey skills, or here's what's going to happen once you do the monkey skills. It is so not a great fucking program, you know, unless it's changed. Now, I have not followed it in 8 years since I became a paramedic. But I know that New York State really wanted, you know, New York State really wanted AEMTs to be great and do all of this stuff. And then the regions were like, no, you're going to do this much stuff. And they really capped what they could do. And now they're taking even more away. They just took intubation away. So it's like, okay, well, what good are they? At least in New York. You could start a line and give fluid. Great. So can I. Like, I don't know. Why are you here? You know? But anyway. We don't have that much left. Let me finish up. So this crew ends up this is where I wish Gerard was here, because he would love this answer. They determine that they are now too close to the hospital to risk wasting more time and RSI him. So a BLS nasal airway is placed and ventilation continues. Finally, M, your blood sugar is taken by the paramagician.
3.
139, actually. 139. The medic then finally spikes a fucking liter bag of saline, hangs that wide open. Good for them. They'll get 20 mLs in by the time they get at the fucking hospital. Another set of vital signs is taken. Blood pressure comes back 93/39. Heart rate of 49 with a sinus brady. Ventilations are being managed now around 20 with the BVM. SpO2 on 15 liters of oxygen is 93%. GCS is 3. Ambulance arrives at hospital. He's offloaded to the ER. Reports given to everybody there, and this ambulance is going to turn and burn and return in service. So my question to you guys is twofold. Thoughts overall, and then what do you think is going on here, if anything? Because we don't have a lot to go on, because they didn't get anything from that girlfriend. Bobkiss, what do you think's going on?
Did well. I think there's things I would have done differently, but overall, I think they did well. I think the AMT definitely got a little tunnel visioned. Could have done better.
I think there was a little panic involved with that too. Like, there was a crash and burn. They couldn't figure out what's going on, so at that point they decided we need to go now.
I mean, he's with a driver only that's CPR certified. Yeah, I hate. This is my soapbox. I hate working with a driver only, just because I rely on my second partner to be there with me. Like, it's never it's my call, I'm in charge. It's your call, you're in charge. Like, this is a team effort all the time. So I'm sure that kind of plays a factor in that. So I do feel for him.
I'm with you, Em. Like,
oh, I hate that.
I wouldn't say I hate it, but I highly dislike working with a driver only. I'd rather work by myself.
Yes.
At that point, I would rather work with myself because the driver only is like, they don't do anything. They can't do anything but CPR. And it's like, I really want, and they want to help, but they just don't know enough to be able to help.
And everyone I've ever met is so nice that I feel so bad, but I hate working those shifts.
Yeah, I tend to agree with you on that one, Em.
I mean, I've had a few EMT partners that were basically just drivers because whenever you try to do anything, it's like, I'm not comfortable with that. I'm not comfortable with doing that. And you're just like,
Yes, run into that too.
just get in the driver's seat and stay there.
Yeah.
Absolutely.
As
for what's wrong, I don't know. Is it neuro? Is it like, I don't know, meningitis or something crazy? Like, I have no idea. I have no idea what's wrong with this guy.
And the sad part is, if we did better questioning beforehand, we could probably get a better, idea of what's going on with this guy.
Undifferentiated shock, final answer.
Oh, that's fucking smart. That's flight nurse level shit right there coming out of her face.
Okay.
Metabolic encephalopathy. How about there? There
you go. So ultimately, it is found in the ER that he has massively overdosed himself with benzos.
Oh, interesting.
And they did blood work. I don't know the levels, but from what the provider said, this guy had like toxic levels of benzodiazepines in his system. They ended up monitoring him. That goddamn.
They didn't reverse him.
What was that?
They didn't reverse him.
So they ended up monitoring for a little while without any change. They ended up doing, what is it, the flumazeril or something?
I know how to spell it. I don't know how to say it.
Flumazanil. Yeah. Which is the hospital treatment for benzodiazepine overdose.
Narcan for opiate. It's like Narcan for opiates. That's for benzos.
Yes. Yeah. And within like 10 hours, this guy was out of the ER.
Interesting.
So, and back at his little cottage. So,
and
with
single.
that,
and getting drunk again,
and probably getting shit-faced and wasted, absolutely. So before I get into the whole benzo overdose, thing, you say interesting, Em. Why is this so interesting to you?
I was curious to see if they were going to reverse them, because coming off of benzos really fast is really dangerous.
Yes, there's a lot of literature out there that says there's really big swings in pros and cons.
Yeah, like a lot of people believe that you shouldn't reverse benzos and you should kind of let them ride it out and just manage symptoms.
Yep.
So that's why I was curious, like interesting that they reversed him.
I'm wondering if they did so because of his airway problem. Like, because he was so unresponsive, because they didn't intubate this guy.
Right, but I could fix that. Like, a hospital should be able to fix that. Well, I don't know. They went to a medical center, so they should. And the thing is like benzos, it takes a long time to come off of. But when you talk about like substance abuse, there's two things that I care about. I don't care if you're an opioid addict, because whether you're withdrawing or high on it, like being high is more dangerous than withdrawing. But when you're talking about withdrawing, opiates and alcohol are the only two things hospitals care about, because it's medically dangerous. Like you can die from withdrawing from that. I don't care if you're withdrawing from opioids. I feel for you, but it's medically, it's not relevant to me. But benzos it is. So you can't rapidly decrease that or rapidly increase it. So it's kind of tricky to manage.
I could only imagine.
Yeah.
And I'm sure that's exactly why they don't give medics the ability to reverse benzo overdoses, because we just would be like,
Well, look at how Narcan is given now from the cops, from fire, from EMS. Like we
From
have
laypersons, yeah.
Yeah, we don't even think twice about giving Narcan, but like for the benzo reversal, you kind of do
Well,
have.
most people don't.
Yeah.
Those of us who have had our asses kicked in the back of a rig or been puked on, or we're like, just enough, but the ones that show up on the scene and give 16, 20 milligrams of stuff, and then go away in their shiny cars and fire trucks, they don't care. But
Gotta
It's
love it.
also ridiculously expensive, so EMS will never get that.
Oh, well, that's good to know.
Yeah.
That's really good to know. So let's get into some of the nitty-gritty education points on benzos and benzo overdoses, because I think this guy fit a lot of what you would see for a benzo overdose. But like I said, not a lot of people are seeing these, right? But in just my care alone, I've seen like 3 of these in the past 3 months. That's like unheard of. Yeah, it's crazy. And then, this call we got a while ago, and it was like, oh, well, maybe this is a thing. This is a thing that might be starting. I don't fucking know. But popular benzos, right? Just to have them in the back of your head, right? Valium, Xanax, which was apparently what this particular person overdosed on. Halcyon, Ativan, Klonopin, Midazolam, right? The one that we use, Versed.
Lanhams and dams are benzos.
Yes. Bingo. The big thing that we have to remember about benzos is they are going to act upon the GABA receptors inside the central nervous system. And ultimately what it does is, as the benzo attaches to the GABA receptors, it slows down the calcium ion that goes through it. So all of the signals that these are carrying slow down. It's like hitting the brakes, and everything just gets slower through these GABA receptors. Ultimately, what you do is your sympathetic nervous system kind of hits a wall and says, I can't do anything, and the parasympathetic just takes over unopposed. So this is why you get the lowering in blood pressure, the lowering in heart rate, the lowering in respiratory rate, the somnolence, the lethargy, the altered mental status, all that stuff, because you don't have any type of fight or flight response that's coming into your central nervous system. All you have is rest and digest, feed and breed, whatever you want to call it, the slow and, slow brake pedal of the body. The other thing that it's going to do is it's going to activate your reticular activating system, which is what your body, that's the system that your body uses for sleep control. So it will make you more sleepy, which is why you saw all those jumps of like, oh, he's awake, and now he's not. Oh, he's awake, and now he's not. And oh, now he's really not awake, and we can't wake him up anymore. You're also going to see stroke-like symptoms as well as glucose-related symptoms. So you're going to see like the slurred speech. You're going to see, the unsteady gait, the unconsciousness. Have you guys ever checked a reflex in EMS? I can't remember that I ever have. But one thing that you might want to try with these types of patients specifically is they lose the ability to have strong reflexes. So if you whack their knee or whack their elbow and you should see a bounce, it won't bounce very much. It'll be very like limited, slow reactions for reflexes.
I never tried those. I've done like the Babinski reflexes, stuff like that.
So I'm assuming you just get a generalized hyporeflexia, so like low reflexes. So I'm assuming that Babinski would probably be, you wouldn't see such a hard toe curl or movement with it. But the other big thing to make note, and this was something that I didn't learn until going through the whole, let me look at all of the information I absolutely can about benzo overdoses, is the chemical structure that makes benzos also has a component of a calcium channel blocker. So as you take a benzo, not only does it, increase your parasympathetic, but it also will have calcium channel blocker effects inside the heart, which also make you bradycardic. So you kind of get like a dual, bradycardia effect, because you get the benzos with the parasympathetic, but then you also get the calcium channel blockers, and they both lower the heart rate. I never knew that about benzos. I just assumed it was, you have no sympathetic nervous system. You have no fight and flight. Everything's going to slow down, and there's nothing in the way to stop it. But apparently that's not the case. So realistically, management comes down to exactly what you guys said over and over and over through this entire thing. Airway, breathing, circulation. That's it. You see the symptoms, you have to manage it. If you got to, atropine and pace this guy, do so. If it gets so low, you have to manage symptoms. We have nothing in the EMS realm, at least in New York State, at the BLS or ALS level, to fix this problem. So all you have is management of symptoms. Biggest thing is you have to figure out why you're having these symptoms in the first place, which these guys didn't do at all. They just said, oh yeah, it's alcohol, or, oh, hey, it's this. And that was it. Let's run with it. We didn't even mention benzos and alcohol. Now you're missing, you're mixing two different parasympathetic drugs, substances, downers, as people would say, that are going to slow everything down. So, you have a perpetuating effect. The alcohol is only going to perpetuate the effects of the benzos, and vice versa. Anything that you guys want to add?
Think about the only thing that probably should have been. At first it was in the back of my mind. Like you said, he went to rehab for cocaine. Obviously the treatment for cocaine is they put people on benzos to help. Yeah. So it was like, but I never thought about a benzo overdose,
Yeah, I didn't think about that either.
Yeah. And it's something that we just don't see all that often, but
everybody's on
some sort
Xanax,
of,
and yeah.
But part of it is too, like, a benzo is a central nervous system depressant. So like it mirrors so many other things that we see so much more, that at the end of the day, it's symptom management.
Right. And that's it. Like, you don't assume, unless they tell you, hey, this guy took 50 Xanax pills. Oh, hey, he got his hands on, somebody's, prescribed Ativan for whatever, and he took all of them.
And you know what I'm going to do for that? Just manage
symptom
symptoms.
management. Exactly.
Right.
And that's the big takeaway from this, is even though you have to rule out all the other stuff, you got to rule out neuro, you got to rule out trauma, you got to rule out, blood glucose. It still comes down to, okay, well, even if this is a benzo overdose, I'm going to monitor vital signs extremely closely, and I'm going to do symptom management, airway, breathing, circulate, and I'm going to be aggressive with those. So put in a nasal trumpet way before they get to be GCS of 3. And now I'm like, oh, fuck, I need an airway. Well, I already had one for the last 20 minutes. Good job, me. Right? Bag them when they start to get respiratory depression, because they will. Eventually, they will not be breathing, just like in an opiate overdose. I think the other thing that you might see that I think might trick a lot of people is, you'll see constricted pupils in benzo overdoses. Because again, it's the parasympathetic taking over. We don't need a lot of light in our eyes when we're resting, so our pupils get tiny. So people might be tricked with, small pupils, unresponsive, Narcan them. But the Narcan's not going to do anything unless something was laced with an opiate. Then you might get a little reaction, but I doubt if it was, if it's just a benzo overdose, it ain't going to do bupkis, nothing.
Yeah,
So-
I legit had a doctor ask me one time. I had someone who may or may not have taken a lot of Ativan, and the doctor asked me, "Would you give him Narcan?" No.
Yeah,
No,
I
I did not.
didn't. No, not one bit. So yeah. Anything else to add, guys, before we ride off into the sunset? This one was definitely interesting for sure. I was kind of bummed that Gerard wasn't here for me to stump him. That would have been fun. Well, guys, we will see you in April as March comes to a close. Miss Flight Paramedic. Let's see where's my cool sound effect for Miss Emily.
Still not a paramedic though.
Did I just say you're a paramedic again? Motherfucker.
So
Well-
someday she'll, step up to the big boys.
EMT badass, whatever, doesn't matter. I will let you do the honors and lead us out.
Oh, it's cool. Donuts.
Thank you for listening to this episode. If you want more information about us and the podcast, or if you'd like to send us one of your messed up calls to review, visit medic-materials.com. There you can also find out how to earn continuing education credits just by listening to the podcast. We appreciate you spending time with us today. Until next time, remember, bad guys will keep their most important possessions in the prison wallet.